I am Dr. Prachet, neurologist. I am here to discuss and tell you some tips about common neurological problems which we face in day-to-day life. I have come across that many people have numerous questions, doubts, misconceptions, and so this idea of this is mainly to give an insight into some common neurological issues, and this is by no means a comprehensive talk. Okay, so let's start off. So today I am going to tell you some things about headache. Headache is by far the commonest condition man has ever faced, and you'll be surprised to know that there are hundreds of causes of headache. So it's no wonder that when a patient of headache comes to a doctor, it's a headache for us too. So I will try to simplify so that you can understand better and know how to go about it and whom to approach. Okay. So when it comes to causes of headache, so as I said, there are numerous, more than hundreds. So you should remember certain things like basically what are the reasons for headache? I mean, what are the causes for headache? Okay. So the causes of headache are numerous, and it's very interesting to know that the brain parenchyma per se, that means the brain matter per se, does not have any pain sensitive structures. That means if the brain per se is damaged or injured, or if we cut the brain parenchyma alone, he or she will not feel pain. So then where does the pain arise? It usually starts in the surroundings of the brain, that means the coverings of the brain, or the blood supply to the brain, okay, or if the pressure inside the brain is very, very high. Okay. So which means it is natural conclusion from this that the ear, the eye, the nose, the throat, the neck, they are all equally important causes of headache. So my purpose is to give some insight into neurological causes and not the others. So I will be confining strictly to neurological causes alone. Okay. So let's start off with neurological causes of headache. Okay. So the neurological causes of headache can be grossly divided into primary and secondary. Okay. So what does one mean by primary headache? So primary headache means when there is no structural cause for headache. Secondary means there is some other structural cause. For example, there is an injury to the head, or there is some infection to the brain surrounding the brain, that is the dura mater, meningitis, okay, or there is let us say some big tumor inside the brain which is causing mass effect, or some of the rupture of the blood vessel inside the brain causing headache. So these are the causes of secondary headache. So we will talk about those later. So I will give some insights into primary headache. Okay. So the primary headache usually means migraine. Okay. However, there are other causes for primary headache like tension headache, cluster headache, so on and so forth. Migraine is the most common cause of headache which affects mankind. It is very common. Okay. I will just give a brief introduction about migraine, and we shall discuss later in subsequent videos more about migraine. Okay. So, migraine is often, there are a few wrong concepts or misconceptions, that it is believed that migraine is always one-sided. In fact, it is called Vatta Talavali in Tamil. Okay. But not necessary. Only about 60% of migraines are one-sided. Second, it is also believed that migraine is incurable, which is also wrong. A majority of them can be significantly treated. Okay. So, this is some insights about the migraine, which we shall discuss in detail subsequently. Now, the most important point of this particular video is, okay, now we know that there are hundreds and hundreds of causes of headache. Now, we say ear is responsible, we say eye can be responsible, we say neck can be responsible. Now, how do we go about it? So, the purpose of the video is not to confuse, it is in fact to get some clarity. Now, if I leave you at this, you will get more and more confused. So, there are some important clues as to how we arrive at a diagnosis, and it is most often by the history. Okay. For example, if there are associated features, for example, if the patient also has significant associated high grade fever and he has some neck pain and he becomes drowsy, irritable, vomiting, then we can think of secondary causes like meningitis. It will be very acute start in the day. Migraine patient also will have severe headache. However, the usual story is migraine starts gradually. They usually will be associated with nausea and vomiting. The headache gradually builds up, and then at the height of headache, the patients will vomit. During the headache, they cannot tolerate light and touch and pain, any sensory stimulus for that matter. Okay, and most often it is relieved by sleep. Okay, and vomiting and sleep gives some relief. Okay, so we will go into that later. Another associated feature are other findings. For example, if there is any slurred speech, or if the face deviates to one side, or if you are not able to close one eye, or one hand and one leg is not moving well, or if there is any problem in balance, then there is something else happening. Okay. So, this is another clue. And another few important misconception again which I come across is, how can a patient have severe headache with a normal MRI? This is a point which many people cannot understand. You must know that not all conditions can be detected on an MRI scan. Okay, and that normal MRI does not mean the brain is normal, and vice versa. And an abnormal MRI does not mean that he or she is abnormal. See, the bottom line is we have to treat the patient and not the scan. They give us some clues to help us in arriving at a diagnosis and ultimately helping you and us. Okay. One last point is that it is also believed that migraine is incurable, which is not at all true, which we will discuss again later. So, to summarize, headache is a very common condition, okay, and it is fairly easy to come into a conclusion as to what is the cause of headache. Most often we can arrive at a diagnosis. So, the take home messages from this video is, don't treat the MRI. Okay. Associated symptoms are equally important. That means some danger signs are difficulty in speaking, difficulty in walking, patient becoming drowsy, The associated signs are very, very important, and of course severity of the headache are also important. Okay, then we'll catch up next time. Goodbye.